Alison, thank you so much for joining me for a Corona conversation. For people who don't know you, could you just introduce yourself and particularly tell us where you are in the world?
So my name's Alison Ritter. I head up the Drug Policy Modelling Program in Sydney, Australia.
And this is now April the 1st.
Yeah.
And if you could just give people an idea of what it's like being in Sydney now.
So I'm at home. And along with probably the vast majority of Sydney-siders, pretty much everyone's working from home. It's not officially a lockdown, it's a shutdown, but basically anything that is not essential is no longer operating in the usual way. Significant numbers of people have been stood down from their jobs. There have been long queues outside Centrelink. There are a lot of people very worried about their health and well-being. From my perspective, there's a bit of xenophobia going on. We have 4 cruise ships circling the harbour who have unwell passengers who are not being allowed to disembark. This is not unique to Sydney. I think there's another couple of cruise ships off the coast of Perth. And, you know, there is a sense that we need to look after our own and close our borders and not provide assistance to, for example, passengers on cruise ships.
Okay. You've said that most of the shops are closed. I'm just curious, are bottle shops still open? Alcohol shops?
Yes, they are. They are limited. So any licensed venue, so on-premise consumption is all finished. So all of the pubs have closed. All of the restaurants and all of the cafes have closed that were licensed. One can still purchase from licensed alcohol sellers, Dan Murphy's and so on. There have been reports of runs on certain alcoholic beverages, people stocking up.
What are people stocking up on?
People stocking up on beer in particular, and also wine, but also weirdly tonic water. Not as a mixer for gin and tonic, but because there was a rumour that malaria treatment, exactly.
So they hear hydrochloroquine and they go, quin, that's in tonic.
Yeah, yeah. So it's very hard to get tonic water from a bottle shop, which is where you'd normally buy your mixer. So yeah. Odd things like that. There was apparently, this is a media report, so not necessarily 100% reliable, but it was based on alcohol sales data that there was a 30% increase in alcohol sales 2 weeks ago compared to a month before. And a 30% increase in alcohol sales, this is based on credit card transactions, is substantial. There has also been a run on the home delivery alcohol services. So one example of a provider is an organisation called Jimmy Brings. You ring them and then within half an hour they'll guarantee to deliver the alcohol to your door. They're apparently doing a roaring trade. So people are purchasing alcohol in different ways from how they've purchased it before. What we don't know yet is whether people are consuming alcohol in different ways, whether the social consumption at venues has shifted to indoors via, you know, Zoom or Skype or whatever else, whether some people are consuming more as a method for coping with stress and so on. So we don't yet know what's happening there.
So that's a nice segue into me asking what's been the impact of COVID-19 on people who use alcohol and drugs in a problematic fashion. So for alcohol, lots of people are stocking up. Some of those people who didn't have a problem may end up with a problem because, you know, beer o'clock starts at 10. What's been the impact so far on people who use drugs? And for people who won't know the scene in Australia, that's primarily going to be heroin and crystal meth.
And crystal methamphetamine, that's right. It's an emerging picture. So the drug trade is still there, as far as we know. there is higher risk of obviously being outdoors, trading in drugs outdoors, because there are so many fewer people, other people around. The injecting centre is apparently as busy as it has always been, but obviously check with Marianne Jauncey about that. There have been changes to treatment. Some of those changes have been really positive, like the change in takeaway dosing of opioid pharmacotherapy maintenance. Some residential rehabilitation treatment services have closed or are no longer accepting new admissions. These are all anecdotal reports. There's a big push to obviously online counselling and support. There's a service that's an online service called Hello Sunday Morning, that I think is in a really good position to do really important work through this period, and they're ramping up, obviously. So I think the service system is trying to find ways to continue to provide care and support. Harm reduction services are issuing fantastic resources to people who use drugs. Great advice about what they can do to reduce their risk of contracting COVID-19. And changes to the way in which treatment is provided, like the changes to the takeaway dosing, that actually are quite positive. And there's been advocacy around changing takeaway dosing for many, many years. And it's just terrible. It takes a global pandemic for these fairly obvious clinical changes to occur.
Absolutely. The rule book's just been ripped off because the risk of corona outweighs any risk of diverted methadone. That's right.
That's right. I mean, in relation to alcohol, whilst there's some evidence certainly of increase in purchasing of alcohol, we really don't know what's going to happen in the long run. We can look to the work on what happens in relation to recessions and unemployment in relation to alcohol consumption. And there's an interesting pattern to those findings from past research. Generally speaking, people who are experiencing problems with their alcohol use reduce their consumption in times of economic recession.
Okay.
And things like liver disease decrease and things like that. But people who are light drinkers drink more in times of economic recession. So there's kind of a price factor for the heavy drinkers and the unemployment rate, and there's a stress factor for the light drinkers in the context of recession and unemployment. Whether that pattern's been seen through the global financial crisis and through other recessions, whether that pattern will be the same this time, because the context of this recession, this global recession, is completely different because of the lack of socialising. Whether that pattern will hold or not is an empirical question.
Well, and on April the 14th, Global Drug Survey will be launching a cohort study to start tracking the impact of coronavirus, not just on people's mental health and well-being, but to see what drugs are they using more of, what drugs are they using less of. But for me, really importantly, why have they made those decisions? And have the consequences been positive or negative? For some people, if you're out doing coke every Friday, this just might be the perfect opportunity for you to go, I'm going to back off. But I think you're right. For people who had relatively controlled drinking because of jobs, roles, responsibilities, it could creep up, or simply being banged up in a house with your wife and kids.
Yes.
Drive you to drinking more.
Yes.
So I think you're right. This is going to be different. You've spoken positively about the treatment service response, harm reduction organisations getting really good information out. Some of the other groups I've spoken to have still expressed concern that the very basics, a roof over your head and food, the most vulnerable, are still not being provided. And you can't expect a group of people whose drug use is often socialised, either because they have to pool funds or they want to use together. I'm wondering if anything's been done locally to give people a roof over their head and just give them the basics.
Well, again, paradoxically, it takes a global pandemic for our Australian government to double the New Start allowance, which is effectively the dole. There have been advocacy efforts to increase the allowance for many years. It has fallen substantially below the poverty line. I know you can measure the poverty line in different ways, but it was doubled 3 weeks ago, which is a substantial shift. And now, just in the last week, the government has announced a variant of the universal basic income. It's not quite the same. So what's been announced is that anyone who is employment, including part-time and casual, the government will pay their employer $1,400 per fortnight to keep that person on the books even if they're not working. So what they're trying to do is, instead of paying money to individuals through a social security system, they're paying the money to businesses to keep people employed effectively, and then the employer continues to salary that person through this period. And the notion is that this is a form of hibernation of the workforce, and that when it is safe to resume, the employees all still have their jobs even though they haven't been working, and the employers still have their, team of staff, and that they can open the doors and it can crank back up. And this is retrospective to the 1st of March,
okay,
which is incredibly generous and significant. So there's been two huge shifts in our social security support system in Australia. The doubling of the allowance for people who are already unemployed or otherwise on social security, and the provision of what's called the jobs package to anyone who's stood down or loses their job as a result of coronavirus. So that's been the biggest reform in welfare support in Australia since basically forever. So it's not housing, but it's huge amounts of money going to people who did not receive that money before.
Absolutely. Can you imagine if that level of pragmatism and foresightedness was applied to other areas of kind of public policy? It's overwhelming just how much better things would be for people. And for the economy as well. I mean, long term, they're not doing it because it's the right thing to do. They're playing the economic long game.
Absolutely.
Remarkable.
So it turns out that some people are better off than they were before. People who are vulnerable, people who are unemployed, are now receiving double as much income as they were, a few weeks ago.
I can imagine Alan Jones must be having a fit.
Look, there's been a lot of talk about how this government suddenly become a socialist government. Yes, there is a lot of criticism of this, a huge amount of criticism, and the experts can't agree whether it's a good strategy or not. It's entirely consistent with my value system and my principles, and I think if Australia has a trial of socialism in whatever format, that's a good thing.
Absolutely, absolutely. So given the fact that we're on April the 1st, we're expecting this to impact on all of our lives really the next 3 to 6 months. What would you think is going to be the consequences on problem drug users 2 or 3 months down the line? Can we expect to see more people coming into treatment and heroin supplies diminishing? Are you expecting to see displacement to prescription medication, growth of the dark net? Any crystal ball gazing?
This is always so dangerous to do any kind of crystal ball gazing.
And we're going to say,
that's right. Alison Ritter said, and look how wrong she was. So given that everything that I say is going to be wrong, I predict a decrease in drug use. I predict a decrease in drug problems and a decrease in alcohol problems based on
over the next 6 to 12 months.
Yeah.
Okay.
Yeah. Treatment services will really struggle treatment services have already been struggling to meet demand before any of this happened. We had a major problem with unmet demand for treatment. This is only going to make that worse, not better. So even though we might see a decline in the level of problems, we're not going to see an uptick in treatment services. I think the key problem that we will face down the track is the fact that there's inequitable access to technology. So whilst we're rolling out the kind of online platforms, someone who is homeless with a comorbid mental health problem is not on Zoom or Skype or WhatsApp or whatever else. We don't have cheap or free internet in Australia. So no matter how creative we are at facilitating non-face-to-face services, they will always favour the less marginalised in our community. And that's a real issue that we need to confront sooner rather than later, is how to get homeless, mentally unwell people access to a good, video conferencing facility. The libraries are closed, which is where a lot of people go for their internet services. Internet cafes closed, obviously. So the places that used to exist don't exist. Whether they will reopen in 6 months' time, who knows?
Yeah, I don't think people realise how much people without a home rely on cafes and restaurants to be able to wash their hands for just basic sanitation. So, and you're right, the internet is now as basic to us as food and water. But I mean, I think you're the first person who's mentioned that issue of inequality. And, and that's an area that you could invest in, that would have huge economic gains as well as health gains for everyone. So I'm going to add that to my list of that would be an amazing thing to happen, to provide free access, which would allow engagement to be easier. It wouldn't mean people wouldn't be DNAing their appointments. It would actually make treatment more effective.
Exactly right.
Okay, so you don't like crystal ball gazing. I want you to now roll on 12 months from now, when hopefully COVID is being turned into a Netflix series and we're all kind of enjoying getting out again. But the changes that you're seeing in drug treatment delivery, which ones do you think will keep? And more importantly, do you think this will lead to some fundamental changes in drug policy around criminalisation of people using for personal use? Which has always been a waste of time, but now would seem to have no function at all.
I can talk about what I'd really like to see. Which is not quite the same as crystal ball gazing, but I think we have the opportunity to use this to change drug policy. Let's take the example of people who are arrested and put in prison for drug use. The substantial savings that government will achieve, and in particular the reduction in prisoner numbers overall, which hopefully will put private prisons out of business because there just aren't enough prisoners. So the shift in ownership of some of these services, I think, is really fundamental. If we could reduce the number of private prisons in Australia, that would be a huge success. And that's not within the government. The only way the government can do that is to reduce prisoner numbers. And basically they're out of business. They don't have enough people to support the actual prison itself. That's not beyond the realm of possibility that we see the closure of private prisons for economic reasons because there just aren't enough prisoners. And then why would you recommence arresting people to then have to fund private prisons all over again to start, doing the same thing? So there are ways in which the economy and industry and business will shift that I think have the potential to be very positive from a drug policy point of view. I mean, the other area is what's going to happen with licensed venues. Any alcohol control policy scholar will tell you that, access and availability is linked to harm. Will licensed venues reopen as they were before with very high levels of associated consumption and harm, or will there be a rethink about how we engage in licensing and engage in different venues? The third area that we haven't talked about is gambling. So, of course, the casinos have closed and the pokie machines and the RSL clubs. I know because you're Australian, you'll understand what all these acronyms stand for. So there's a major problem with people with gambling disorders who are needing to deal with their gambling disorder at home. It's potentially an opportunity for them to realise how much they were spending on their gambling. But governments have relied enormously on gambling revenue. So their coffers are going to be reduced as a result of the closure of the gaming venues, the pokies, etc. And maybe that's also then an opportunity for pause about the extent to which government is reliant on income from basically problem gamblers. I mean, also problem drinkers as well. The taxation from alcohol will also reduce, presumably, if consumption reduces. So there are ways in which the government will be forced to look at how its revenue sources, you know, what comprises its revenue sources and where are the revenue sources from vice, as they're known, and how much those have impacted on government income. So that'll be paused for serious consideration, I think.
It must be terrible for Sydney after 3 or 4 years of lockout laws, with those venues just coming back online to be nailed by that. But I'm assuming the A&E departments aren't full of people fighting pissed up on a Friday night. You know, right. Rules are down. Although I would worry about probably increased risks to domestic violence with alcohol within the home.
There's been a huge concern about domestic violence. There's been, I think it's 150 million announced by the government to dedicated domestic violence services to cater for the needs of women in this particular circumstance. And we're not allowed to leave the house unless there's risk of domestic violence. So that's actually one of the specific exclusions for a valid reason to leave the house. There are fines of up to $1,000 for anyone who leaves the house without a valid reason, and there are 6 or 7 reasons. One of them is violence in the home, which is extraordinary to have that recognised at a national level on a list that's going out, you know, be widely promulgated. So there's huge recognition. Whether the response is going to be enough to save some women's lives, I don't know.
I just want to come back to gambling. So they're not going to be simply displacement to online gambling, or are there a group of people who really do just do pokies, RSLs and casinos?
Yeah, there are definitely people who just do RSLs and pokies. There will be a shift to online, but the difference is that it depends if the person's at home alone or with family members. The difference is it's then obvious what's going on if they've got family members there. So part of the reason why many people go to the clubs to gamble or play the pokies is because they're anonymous there and the family can't see. So there'll be a much greater transparency of gambling activity in the home than there was previously. But you know, how much it gets displaced onto online. I mean, the other thing we haven't talked about, of course, is sport.
I was going to say, no sport to gamble
on. So no sport to gamble on. And, you know, as you know, Australian culture is very, very fixated on sport. With the cancellation of our football, all 3 codes, AFL, soccer and rugby, and a whole lot of other, you know, sports, that is really significant culturally and socially for Australia. And I'm not going to predict what's going to happen.
No, it's not. I think you've done a great job so far. The last question I just want to ask you is around the impact on Indigenous Australians, whose lives are marred and challenged in so many ways.
Yeah.
Is there any particular recognition for the impact of COVID on that group and any provision for that group?
Yes, there is. There has been a lot of talk about that group. Basically, communities want to seal their borders, and communities in the Northern Territory did so quite early, 3 or 4 weeks ago, maybe more than that, 5 weeks ago. And no one is now allowed to enter an Aboriginal community, full stop. Only the people that are there. There are challenges because many of the Aboriginal communities are in areas that are really poorly resourced in terms of healthcare services. So there's a debate right now about whether some Aboriginal communities should move closer to cities where there is healthcare, but increases the potential for infection. But once you get one person in the community that's positive, it'll be a disaster because the healthcare services just don't exist out there. And the best thing to do would be to follow what the Aboriginal communities want for themselves. And there's a particular Aboriginal community outside of Alice Springs that wants to relocate to just outside Adelaide, but the Adelaide government is saying no. So once again, we see Aboriginal people being disempowered, not being allowed to make the kind of decisions that they want to make, that they believe is in their best interests, by basically white fellas. So that's a really tragic situation. It might have resolved today. This became very clear last night. Maybe the South Australian government has changed its mind, but what was very apparent was an inability to listen to Aboriginal elders and to take their wishes into account.
And for Aboriginal elders to leave their traditional land, that would have been a decision that would not have been taken lightly at all.
Not at all. Not at all. Exactly. Okay.
Alison, thank you so much. I mean, it's just been fascinating. Again, just to see the huge impact on different cultures. Like, you often think Australia's not that different to the UK,
Sure.
but actually, I mean, some of the things are the same, but there's huge differences, and that's why I wanted to reach out and talk to you today. So
yeah,
I think we may have to come back to you in a month or two. And
sure.
we won't be picking off your crystal ball gazing, but just to get an update, because
sure.
Things
Happily. I think it's it's a tragic time and it's a scary time, but it's also potentially a time of opportunity for drug policy reform.
Absolutely. Alison, please take good care of yourself.
Yes, likewise.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine.